More money news now on Ask the Expert. Healthcare. Okay, it's a word that everybody's been talking about. It's been on our minds, and for good reason.
For most people, it is one of the biggest expenses in any given year. Our certified financial planner, Andrea Cave, joining us this afternoon to tell us about a powerful tool in the fight against rising healthcare costs. What are we talking about here?
We're talking about health savings accounts, or they're referred to as HSAs. And they're actually a really great versatile tool because you can pay for so many things out of it, like dental and eyeglasses and hearing aids and doctors and deductibles.
Vitamins in some cases.
Yeah, as long as it's a qualified medical expense. The list is pretty extensive.
So what are some of the tax advantages to using your HSA to pay for these things?
Well, if you compare it to other tools like that people use for savings in retirement, like an IRA or a Roth, it has a component of both. You get a tax deduction when you make a contribution, and as long as you pay for a qualified medical expense out of it, it's tax-free when it comes out as well, which is a big advantage. They actually last year just raised the exclusion. If you itemize, and maybe you itemize your medical deductions, it's increased from 7.5% of your adjusted gross income to 10%, which really just means there's less that you can deduct.
So this is a way around that, essentially.
It's a way around it. It also is a planning tool that can be used as part of a good financial plan, because you'll always have some expenses, whether it's deductibles or dental expenses, and you can plan for it and accumulate over time because it never goes away like a flex spending account.
See, I'm loving this because I just put two and two together here. I've been frustrated because I have medical bills like everybody else does, but the threshold is so high. It's 7% in the past, 10% of your income now before you can start to deduct your first dollar.
Sure, and you know, the other advantage is there's no income limit. So a lot of the plans I was mentioning, like retirement plans, they have income limits, and there isn't any for an HSA. So it actually is a really versatile tool. You can see it's tax deductible going in, tax-free going out, which is actually better than any of the other kind of plans when you start gearing up for retirement.
So quickly, HSA good for everyone, or are there people that it might not work well for?
You have to qualify, meaning you have to have a high deductible health plan, and there are some real specifics as far as how much and that sort of thing, but almost everybody has expenses, so as long as you don't have a flex spending account and your deductibles work, I say it's kind of a no-brainer. There's not much of a downside. Sure, and you know, a lot of people's emergency or unexpected expenses are medical. One of the things, like if you plan for that, and you know you may be able to pay less in premium and pick a higher deductible plan, and then save for it, and then if you make it 1 year, now you've got your deductible for the next year, and it's a big savings.
All right, got a question for the experts? Email them. AskTheExpert at TMJ4.com. You can also leave a voicemail at the number on your screen. Andrea, thanks.